is likely dead, according to investigators. All right, here to help with our investigation, psychotherapist, CEO of Life Counseling Solutions, Dr. Janie Lacy, and author and certified mental health counselor, Sharonda Brown. Dr. Janie Lacy, I'll begin with you. You're in court, and the judge says, I'm giving you a break. You know that your own daughter now will never walk because of what you did. How could someone then walk out of that courtroom and then abuse another baby? We're not talking about child abuse here. This is baby abuse. Whole different scenario. How can that happen, Dr. Janie Lacy?
You said it, Vinny, a whole different scenario. And, you know, we have to address exactly what you just mentioned, him walking out of that courtroom. First, I mean, it's just the fact is, first, there was a system failure. We know that when individuals that have serious child abuse convictions, like in this case, when they receive lenient sentences or inadequate monitoring, the risk to other children remain elevated. We know this, right? The research backs this up. It consistently shows that without intense intervention, the rates of repeated behavior remains dangerously high. But when we look at this situation, we know that cases similar to this, when individuals have previous convictions for child abuse and they now face new allegations involving, in this case, another infant, we know that there's an escalation pattern that occurs. And with this system failure, there was an opportunity to have intervention. There was an opportunity to save Emmanuel's life, and it was complete a system failure. But there's escalation patterns that we know when there's experiences of potentially his own childhood trauma, his own abuse, and not having any type of intervention. It's common among offenders who have their own trauma history that increases their risk of criminal conduct, as we see in this case, Vinny.
Sharonda Brown, it's shocking, it's outrageous, but how could someone do that to a baby, get a break, not serve time behind bars, and then turn around and allegedly do it again?
I think we're trying to rationalize an abuser, and we both know that abusers are addicted to control, and their most common victims are those who are defenseless, who, you know, cannot fend for themselves, who are most vulnerable, and that involves children and babies. When I hear about babies being abused, it lets me know that the issue is not necessarily the baby, but maybe the role that this person or that the abuser has to play. So I'm thinking, okay, he's a father, he's gotten away with this multiple times, which means he's probably has some type of issue with fatherhood or has some type of trauma with his own father. And so what I noticed with abusers is that they tend to go after the victims who represent who they were when they started to become abused. So it lets me know that there's an issue here with fatherhood, there's an issue with babies, there's an issue with the responsibility or the role. And what helps increase this is how often they get away with it. Abusers are fueled by the number of times they get away with it, not necessarily by the victim being hurt or being upset. It's really about how often they're able to get away with it and not have consequences.
You know, I was doing the math, and I believe if he was put in prison, the child would not even been conceived to begin with. He would have been locked up. I don't think this baby would have been born, Emmanuel. But let me ask you about this, Janie Lacy. A lot of people are wondering, why would Rebecca have a child with a man who put his child in bedridden for the rest of her life by abusing her? Why would someone even decide to have a child with someone like that?
Well, Vinny, we see this all the time in these toxic dynamic relationships. So my assumption would be that Rebecca has her own set of challenges, and perhaps, you know, her addiction in particular to him and wanting to please him, that they will sacrifice their own children, they will abandon their own self to constantly get the validation or, you know, chase this empty love from their partner, to the detriment of what we're seeing here. So when we look at women in particular that have their own trauma history, that have abandonment issues, you know, their own core wounds, they will pair with people potentially who will it's what we call trauma repetition, that they will feel the same thing over and over and over again. They're trying to perform and audition and try to get that validation and that attention, to the point where children are abused, neglected themselves as well. You know, because I would imagine that there's probably some level of abuse in their relationship, would be my assumption when we consider Rebecca going along with this story for her own child, Vinny.
Yeah, and a lot of people are wondering about that black eye, where it came from. Dr. Janie Lacy, Sharonda Brown, we're out of time for tonight, but we'll do this again.